Pathology stains. Here we look at the HND. The HND, it is the most common histopathology and it is used for almost all slides. Then we look at the perpendicular stain. So here it is a universal stain and it is used for the cytological preparation. And it is used in case of the cytological studies. Then the PAS stain. This demonstrates the glycogen, mucin, fungi as well as the macrophages. Then moving on, also in case of the Whipple's disease, adenocarcinomas, glycogen positive tumors such as the Ewing sarcoma, the renal cell carcinoma. Then the PTAH, that is the phosphotungstenic acid or hematoxylin. So here this stains the fibrin and the diseases here includes the gliosis, ependyomas, tumors of the skeletal muscles as well as the fibrin deposits. Next we look at the Alcian blue. So the Alcian blue is for the acid mucin. It is positive in case of the mucin of the intestinal mucosa and it is negative for the mucin of the gastric mucosa as well as the Brunner's gland. Next what we look at is a Prussian blue. So this demonstrates the hemosiderin as well as the iron. So the diseases, it includes the hemochromatosis. Then we look at the Mason's Fontana stain. So this, it demonstrates M for M, melanin, and the nevus and malignant melanomas. Then we look at the VK method. This is the von Cosa. Here it is for calcium and this shows the presence of calcification of the tissues. Next we look at the von Jansen stain. So here the collagen as well as the differential amyloid from the, it differentiates amyloid from the collagen and the spindle cell neoplasm and the delineate extent of fibrosis. Next looking at the Mason trichome stain. Here it is about the collagen and the muscle and it shows connective tissue disorders, muscles and the fibroblast tumors, liver cirrhosis as well as the neuromuscular disease. Then we look at the reticulin stain. So here reticulin fibers are present and they distinguish the epithelial from the non-epithelial neoplasms. Then Hodgkin's lymphoma as well as they show the early cirrhosis of the liver and the myelofibrosis. Next, the Verhoef method. So here it includes the elastic fibers, then the malignant hypertension, arteriovenous malformation, aneurysms. Next, the Marfan syndrome as well as the emphysema of the lung. Then we look at lastly the oil red or Sudan black. So this is for the fats and lipids and the fatty liver fat embolism, that is the fibroma versus the thecoma of the ovary, that is the liposarcoma.